here is early diagnosis and treatment. Luckily, with a lot of sensitization happening in the form of lectures, workshops, I think most of the primary caregivers have been able to pick it up. But we need your support to push it forward in the sense that, regular follow-up. So like a kid is born, of course, worldwide, the kid has to be seen on day 3, day 7, day 21. That's the reason, pick up early diagnosis of jaundice. So usually jaundice it can be physiological, which goes away with time, and then there is something pathological where a kid might or may not need liver transplant and may need medications further. So unlike the adult world, there are more than 20 to 30 diseases which can cause liver disease. So it's like a sea of diseases, and you actually have to figure out which one the child has, or the infant jo ek saal se niche ka bacha, what that child has. With the great team, with Dr. Gaurav and his colleagues, with the good surgical hands, we have done around more than 125 liver transplant. Now we are at a different setup at Nanavati Max, but we have been able to do young kid as young as 4-month-old, somebody who's less than 4 kg, doing transplant within 24 to 36 hours, which is called as acute liver failure. So a lot of things can happen. Again, unlike like what he said, hepatitis A again is common, but with the medical management, we are able to, just last 2 months, we have saved almost 3 kids who were almost like at the verge of having a liver transplant. They were so sick, they were on the ventilator, and we were able to salvage them without a liver transplant. But keeping them in a tertiary care unit, at least we can prepare for a transplant if the transplant is required. We can address the issues with the parents and with the guardians who is around us. There's something called biliary atresia, which is one of the most common disease in childhood, followed by a lot of things something like progressive familial hepatic cholestasis, which actually can run in the family. So our patients dekha, both the parents are carriers, so they will not have the symptom, but they still have that gene mutation which can cause. So when two people marry, the kids have high chances, more than 50% chances that the kids can also have the same. So that is something called hereditary or familial. Followed by Wilson's disease, there's something called, which is like copper problem. Copper is not able to, we are not able to excrete the copper in the right way. It gets deposited in the liver and in the brain. Likewise, there's so many diseases with the protein, channel deformation, with carbohydrate metabolism issues, urea cycle defect. There are multiple of it. These days, we have been picking up more something called as Crigler-Najjar. So have a special mention of Crigler-Najjar, where the jaundice starts very early. So the kid can be jaundice on day 3. It progresses with time. बढ़ते ही जाता है. Sometimes the bilirubin level reaches critical, and the bilirubin gets into the brain, and there can be permanent damage in the brain, and the child can have motor dysfunction in the form of not able to walk, not able to have a proper speech and all. So I think that early diagnosis and management is important. As I said, Wilson's disease, there are a lot of drugs available, so we can keep the kids on the medical management if they come at the right time and they have a compliance with the medication. Similarly, there's something called autoimmune liver disease, where we have been treating such kids without transplant. But yes, many a times when the things go haywire, they will require a transplant. So I think in a setup like ours, and since we have started this OPD in Goa, just today I saw almost 3 patients so far. So I think that has been like something which we want from your end too, that the more the message spreads, the more people will be able to refer us the patient, and we can do the needful. Thank you.
One thing I want to highlight in pediatric population, a lot of times jaundice is just passed off as physiological jaundice, that this is just going to get better with time. But catching the kids with a problem early is very important, because there are conditions like biliary atresia or metabolic liver disease. If you treat only within a particular period of time, you can prevent permanent liver damage. So they give you a very small window of 2 to 3 months only. If you keep on delaying that the jaundice is going to disappear with age, then you will lose the window of treating. So again, for the pediatric population also, this is a very important message, that if there is jaundice at birth, you need to get the child treated properly by a liver physician. So a lot of subtle things which can be picked up by a liver specialist which may be missed.
Thank you, sir. Thank you so much. So, as we said, we have a few of our patients today with us. Mr. Naik is one of the patients whose story you, of course, read in the release that we shared. So, Mr. Naik, if you're there, and if you can. नाही सर प्लीज. सो तुम्ही जर तुमची स्टोरी शॉर्ट मध्ये लोकांना सांगू शकाल तर that will be great. So he is one of the patients who has undergone a successful liver transplant with under Dr. Chopper.
Can they come up?
Sir, please go there.
Even with the
Sir,
donor actually.
sir, you can sit. No, sir, please, आप लोग बैठिए. Please stand. You will sit. You will sit.
सांगायला बरं आहे.
And hello everyone, good afternoon. My name is Jayendra Naik, and today I am standing in front of you with a heart full of gratitude and a life that feels truly gifted, a second chance at living, and thanks to some extraordinary doctors and timely medical care. Actually, I was suffering from diabetes and BP since 2005. My liver-related symptoms began quietly in 2017 when ultrasonography reports indicated a non-alcoholic fatty liver. In October 2023, I started experiencing swelling in my feet, abdominal bloating due to ascites, and daily episodes of diarrhea. I had no idea that this was just the beginning of something far more serious. So in July 2024, that is exactly last year, in July 2024, I suddenly took ill and I had to be admitted to hospital as an emergency case. I had severe episodes of melena in form of diarrhea stools, and this was basically because of the rupture of the esophageal varices. My hemoglobin dropped down to a dangerous level. It was like 5.5, and I was suffering from amnesia. So I was at that point in time diagnosed with decompensated liver cirrhosis. So at that point in time I underwent EVL treatment. It's a gold standard for esophageal bleeding, and also the blood transfusion. So that point in time, quite literally, my life was saved, and I was advised to undergo liver transplant as a sure cure for liver cirrhosis. So the moment I heard liver transplant, it was a very frightening thought, and I was really nervous and confused until I met Dr. Chopper, a legendary and India's leading, I would say, liver transplant surgeon from Bombay, whose strong words actually changed everything for me. Dr. Chopper calmly explained me that a transplant wasn't needed at that point in time immediately, as the scan reports looked quite stable and normal. So actually it is his confidence and guidance gave me a sense of peace. However, he advised me to get myself registered for liver transplant. So for which I had to go to Bombay or rather Mumbai, and to my utter shock and surprise, the CT reports and the scans revealed that my case was a end stage liver disease, that is cirrhosis with HCC. So that was not visible in the previous scans in Goa. So Dr. Chobal told me clearly that waiting was not an option anymore. So I had to take the decision to go for liver transplant. So at this most crucial moment, my wife, Ms. Rupa Naik, stepped forward to donate part of her liver to save my life. And this was a very, I would say, selfless and a brave act. So on 25th December, there is a Christmas day, 2024, under the skilled hands of Dr. Chopal and with his very good team of surgeons, and I underwent a living donor liver transplant at Nanavati Max, Mumbai. My wife underwent robotic donor surgery. Miraculously, my recovery was faster than what was expected, that anyone could expect. I was up on my feet and and walking within, like few days, I was on my feet and walking. And within weeks, I regained my energy levels. My energy levels were back to normal, and I regained my health. And most